Okay, so far we have understood triage on a very basic level, what it is and why it was introduced, and how history shaped modern medicine, modern emergency medicine to be specific. Now it's time to see that how triage works in a real life emergency setting. To understand this, we will use a scene from medical drama series called the PITT, where triage is shown in realistic emergency department. This scene will help you to connect the dots with actual clinical practice and understand how healthcare professionals quickly assess, prioritize, and manage patients based on their severity of the condition.
They check in for registration here. The nurse eyeballs them, make sure they're not dying. If not, they're moved to one of two triage rooms for vitals and a quick chair exam. You can do your labs and your x-rays.
And then they come back to
Waiting room till bed opens up.
for how long?
8 hours if they're lucky. A lot of times 12.
Is it always this busy?
No. It gets a lot busier.
So before a patient receives a treatment, the first stop in the emergency department is the registration desk, where basic details like patient name, age, and the reason for the visit to be recorded. After registration, a patient is taken to the triage room, and the triage room is a dedicated area where a trained nurse quickly assesses the patient by the condition by checking vital signs, symptom, pain level, and the urgency of the illness or the injury. Based on the assessment, the patient is given priority level and directed to appropriate treatment area. This process helps nurse and medical staff ensure that the critically ill patient receive immediate care while stable patients wait safely for their turn.
What's going on?
Mass casualty at PITT Fest.
How many victims?
We don't know. Expect the worst.
So what happens in the second scene is a real-life emergency unfolds just outside a trauma center. This scene demonstrates how doctors, nurses, paramedics, and other hospital staff work together as a coordinated team during a mass casualty accident. It also shows that why triage system is followed so that every patient is assessed quickly.
There is an active shooter at PITT Fest. As the nearest trauma center, we are going to be getting the majority of the victims. We don't know yet how many we are getting, but we are instituting hospital-wide emergency protocols. We need to move every patient out of here. They either go home, they go upstairs, or they go to family medicine.
So, in this scene, the hospital has just received a warning of multiple victims from the PITT Fest. It's a mass shooting on their way. Before the first ambulance even arrives, the emergency department activates its MCI protocol.
MTI protocols.
Which is a mass casualty incident protocol.
Call your loved ones now if you need to. I can guarantee you cell service will soon be overwhelmed. Eat something, stay hydrated, use the bathroom while there's time, and meet back here for a full briefing in 5 minutes.
Once the emergency protocol is activated, the charge nurse or the chief doctor quickly briefs the entire emergency department. Staff members are instructed to finish eating and drinking and use the restroom and make any urgent phone calls to their families, because once the patients start arriving, there may be no opportunity to step away for several hours. Everyone is assigned a specific role. Extra trauma teams are assembled, essential equipments are checked, and every member of the hospital is alerted, and additional doctor and nurses and respiratory therapists support staff are all called in. Medical supplies are restocked, patient flow is reorganized, and the stable patients are moved or discharged whenever possible to create space. The triage is expanded outside the emergency department also, so incoming casualties can be rapidly assessed, prioritized, and directed to the appropriate treatment cases. The goal is to save greatest number of lives. and ensuring the hospital is fully prepared before the first patient arrives. Okay, so that was a brief introduction to how hospital prepares for triage before the patients start arriving. In the next video, I'm gonna break down every step in detail, and I'm gonna cover more episodes from that series, breaking it down into small chunks from the triage workflow and staff roles to the equipment, supplies, room setup, color coding, which is very important, everything else used in real triage cases. So follow me for part 2.